Ms. Tripoli, in your written statement, you referenced the fact that the percentage of physician practices that were hospital-owned rose from 15% to 53% from 2013 to 2021, and nearly 23,000 physicians left independent practice to work for a hospital or other corporate entity after the COVID-19 pandemic. That decrease in competition drives up healthcare costs. In your opinion, what factors are leading more and more physicians to leave their independent practices?
There are probably several, but the two I'll focus on is the first is that we vastly, significantly undervalue and therefore underpay primary care and behavioral health providers, which disproportionately make up a lot of independent physician practices. And the result is that they are financially vulnerable. And the second is we have these incredibly broken financial incentives where we, site of service payment differentials that actually have this incentive for big systems, hospitals to come in and buy up physician practices. The independent physician practices rebrand those practices as outpatient departments so that the hospital system can generate a higher reimbursement. And those two factors, has particularly been accelerated from the COVID-19 pandemic, where the financial vulnerabilities of these independent practices were hit very hard. Primary care nearly collapsed. And so I think a policy like site-neutral payments helps to address some of those problems at the root. From site-neutral payments, you can actually take some of that savings and reinvest it to increase investments in the very physicians, primary care, behavioral health that we need on the front lines of the healthcare system.
Thank you. For years, physicians have been experiencing cuts to their Medicare reimbursements, even while other Medicare providers have experienced increases for inflation. From 2001 to 2023, inflation-adjusted payments for physicians declined by 26%, even amid the rising costs of running a medical practice. On top of that, physicians are facing a 3.37% cut this year unless Congress takes action. We can't afford for more independent practices to close their doors or to take fewer Medicare patients because they can't afford to treat them. When physicians leave to join large hospital systems, this can create barriers to care for our most vulnerable patients, especially in rural areas that often bear the brunt of healthcare workforce shortages. A major way Congress can address rising healthcare costs stemming from consolidation across the healthcare system is updating the Medicare physician fee schedule. Ensuring appropriate Medicare reimbursements would reduce the strain and burnout on independent practices and help reduce the trend of consolidation. My bill with Congressman Bouchon, the Strengthening Medicare for Patients and Providers Act, would do just that. And we should also be investing in residency programs like Teaching Health Center graduate medical education to develop a healthcare workforce that stays in the area where they are needed the most. Oftentimes, if a patient is out of network, insurance companies underpay what the cost of that care was for that patient. When you have small practices that can't negotiate at the negotiating table with large multi-state national insurance companies, then they are vulnerable to a take it or leave it type of negotiating practices because if they don't take it, it doesn't really matter for the insurance companies. So I think that our no surprise billing law that we passed, which had the independent arbitrator, baseball star arbitration from my bill, helped to avoid patients getting surprise billing. But we still have work to do to help providers be at an equal negotiating level with insurance companies so that they can get a fair reimbursement for out-of-network costs. What other ideas do you have that could help us improve patient care and access to care as we've discussed? Yes.
I completely agree. Protection and ongoing implementation of the No Surprises Act is critical. I think in terms of lowering costs, making sure that we're not only addressing high hospital prices and many of the solutions that this committee has advanced in the Lower Cost, More Transparency Act around price transparency, site-neutral payments, transparency across the healthcare system around PE ownership, and also continued implementation of the Inflation Reduction Act. We know that drug prices continue to go up. That has been a hugely important piece of legislation now being implemented. As Medicare begins negotiating those drugs, we're going to see drug prices come down, and that will result in direct affordability for the American people.
Thank you.
Thank you.